This is Thinking Out Loud. Meet Miss
Yole and
this is Ugo. Welcome to today's Thinking Out Loud. So this is us just thinking out loud with things happening around our world today. And today we are seeing this craze, this trend going on now about the real body type, what it is to look good, what the real definition of beauty is. And today we see this trend, BBL,
oh wow,
going on. Like
plastic surgery.
it's beyond me. People now believe that the perfect 8 is the real beauty, which is you accentuating your waist so deep. Some people go as far as removing their ribs. Some people go as far as, putting in breasts that is
Implants.
beyond, breast implants. And then some go as far as putting like 80 liters. I don't know what exactly, but
Sucking out fat from your stomach to your body. Right?
So the real definition of BBL is a process of plastic surgery whereby you get fat from your other body parts that we believe needs to be thinned out, and then pour it or inject it into the buttocks to enhance the figure 8.
Okay.
You get what I mean?
That's right.
So Yoli,
There are pros to plastic surgery. Plastic surgery enhances your beauty, makes you feel confident, your self-esteem, boosted. You get better opportunities because when you walk into a place, everybody's like, okay, she's fit, she looks good. So there are advantages to plastic surgery, but the cons is what is the issue that comes with plastic surgery, and we wanted to know about that.
I believe that with this craze, it's mostly our celebrities, our influencers on social media are pushing this body type, and it's very unrealistic because in the olden days, our mothers, they had children, they look good, and they never, died over trying to have a big butt. And
Exactly.
what do you think about this?
I think when it comes to we Africans, because we already have this
But-
natural
Body.
exactly.
I feel like
so-
no Nigerian woman needs a BBL because every Nigerian woman has something behind. I've seen people walking on air at the back and there's nothing in there. But every Nigerian woman has something. And the worst thing is that they will still go ahead and push all this fat and add it again, top it. Like there are some that you see that when they top it on top, I'm wondering, are they gonna make a different diaper for these people? Because I know at some point we're all gonna wear diapers, okay? Are they gonna make a different diaper for the people their own is shooting out and the people their own is coming in? Or are we gonna start measuring butts to know your diaper size in the future?
We're actually not really against you doing surgery. We just wanted you to be more careful. As Africans, we have natural birth, but there are some nationalities who don't have as much birth as we do. So which means they have excuses for, okay, I want to have this shape, which is okay, but you need to know the cons that comes with the surgery you're going for.
So with BBL, the problem with it is that there are so much risk, and the risks are beyond. Have you heard it's like the most riskiest of all the cosmetic surgeries? And I tell you what, I myself is gonna tweak my body if I think I need it, but I don't think I am that crazy about BBL. You will never see BBL on me, okay? Don't worry about it because I'm telling you, BBL has the risk for infection is so high. The risk, because some of them will say, oh, after BBL you're not able to wash it under, that's why it's smelling and this. Imagine when it's smelling to the next neighbor. Imagine what your body is going through that has it. And then it also comes with the risk of fat embolism. Some people even die on the table when they are transferring this fat because the butt has so many blood vessels and they are tiny ones and they don't have any machine that it takes where they're injecting it. They're just looking at the surface area. Oh, this place is deep, let's inject more to push it more up. So while they are injecting, there is a blood vessel right there, and it can go into your bloodstream and cause fat embolism, and somebody dies. You might not die at the table. The person might go home 2 weeks, 3 weeks. The fat will travel. It's a problem. So I'm telling you, and sometimes the results are not even. Now you see people walking around with pillows. And they're sitting on one butt all the time, eating up all the fat. Auntie, I'm telling you.
I think for every surgery you do, there's side effect. So just imagine plastic surgery. Side effects could be from you having to go for more surgeries, because probably the it's not even, something is falling off, or something is bigger, or something. Particularly with BBL, there's so many issues about it falling flat or something, and you're going to have to lift it up.
The thing is with BBL, over time, the fat kind of decreases. It kind of the body absorbs some of the fat, making it to thin out. So you want to go add it more to get it fuller. So imagine the skin sagging at 60, and you're sitting there with that sagged fat.
So you have the urge, or you have to go back to reconstruct
and push it back up.
But and these surgeries are very expensive, and it's, I feel like we have unrealistic expectation with this BBL surgery, because I mean, it's good initially, the process of the surgery and the healing and everything, but we're having so much expectations. We're not thinking about 5 years from here, 10 years from here. What's going to happen to me? How is my body going to change? How am I going to have illnesses, or that's going to affect me from taking care of the surgical side? We're not thinking about the long-term goal. We're just thinking about how to do.
And as a woman that is thinking out loud, the recovery time is so long. Not only that I know that with time, we women, we suffer a lot from knee pain, being arthritis and all. How are you going to carry this whole weight all on this knee in time to come?
But you know that there are some celebrities who are now going after taking out their BBL. So I think
so the thing is, when you do it later, you go and take it out.
I think that's what's happening now. So.
I don't know. Whatever you choose to do to your body is what you chose, and we are not against it, but want you to be careful, because I know in America here, when they want to do surgery on you, they make sure that you have not done any surgery at least for 3 years, and they make sure your heart is able to carry it. EKGs are done, CT scans are done. Make sure every road is clear before you go lie down on that bed. They make sure your lung capacity can carry the air before they lay you down and start BBLing.
So basically, you have to go for good consultation first, and good physical.
Make sure to research your doctor. Make sure you see all those reviews. You ask questions and see if the doctor is the right fit before you go. And then make sure you take care of yourself afterwards, and listen to your body.
And also know your family history.
Yes.
Because the family history, you might be at risk for blood clots, and you don't even know all those history. And you're at risk of hypertension, you're at risk of serious medical diagnosis. Know yourself and let your doctor know about those risks also. Yes,
I've seen people that have weight just like us. The doctor will tell you how much weight you have to lose for you to go through this surgery. Some people will insist, I'll pay more money instead. Please don't pay more money. Listen to that doctor. Follow instructions. Do the right thing. I think the most important thing is for you to come out healthy and alive. Okay?
And keep up with the follow-up.
Appointments and maintenance and all that. Honey, we are all here for you. Look good, smell good, feel good, and this is Thinking Out Loud.